Question 1. To address the challenge of a service user expressing a strong preference for a specific therapeutic modality that may not be the most evidence-based or suitable for their current presentation, what is the most ethically sound and professionally responsible course of action for a health and care professions council registrant? Option A. Politely but firmly decline the service user's requested modality, explaining that it is not within the scope of practice or deemed appropriate, without offering further discussion or alternative options. Option B. Proceed with the requested therapeutic modality without extensive discussion, assuming the service user has sufficient knowledge to make this choice, and document the decision as per standard procedure. Option C. Engage in a thorough discussion with the service user about their preference, conduct a comprehensive assessment of their needs, and collaboratively explore the evidence base, potential benefits, risks, and alternatives to the requested modality, ensuring informed consent is obtained for the agreed-upon plan. Option D. Immediately implement the therapeutic modality requested by the service user to honor their autonomy and avoid potential conflict, regardless of its evidence base or suitability. The correct answer is C. Engage in a thorough discussion with the service user about their preference, conduct a comprehensive assessment of their needs, and collaboratively explore the evidence base, potential benefits, risks, and alternatives to the requested modality, ensuring informed consent is obtained for the agreed-upon plan. Explanation. This scenario presents a professional challenge because it requires balancing a patient's expressed preference for a specific therapeutic modality with the clinician's professional judgment regarding its suitability and potential efficacy, all within the Health and Care Professions Council, HCPC, regulatory framework. The HCPC emphasizes that registrants must practice within their scope of competence, act in the best interest of service users, and maintain high standards of professional conduct. This involves informed consent, which requires providing sufficient information for a service user to make a decision, but also the professional responsibility to guide that decision based on evidence and ethical considerations. The correct approach represents best professional practice because it prioritizes a collaborative and evidence-informed decision-making process. It involves open communication with the service user about their preferences, a thorough assessment of the proposed modality's appropriateness and potential risks and benefits in their specific case, and a discussion of alternative, evidence-based interventions. This aligns with HCPC standards that require registrants to obtain informed consent, practice competently, and act in the best interests of service users. It upholds the service user's autonomy while ensuring their safety and well-being are paramount. An incorrect approach that involves immediately agreeing to the service user's requested modality without adequate assessment or discussion of alternatives fails to uphold professional responsibility. This could lead to the provision of ineffective or even harmful treatment, violating the HCPC requirement to practice competently and in the best interests of service users. It also risks undermining the informed consent process by not fully exploring the service user's understanding or presenting all viable options. Another incorrect approach, which is to dismiss the service user's request outright without exploring their reasoning or offering alternatives, demonstrates a lack of respect for their autonomy and can damage the therapeutic relationship. While the professional judgment of the clinician is crucial, a paternalistic approach that disregards the service user's expressed wishes without proper justification is ethically problematic and may not align with the HCPC emphasis on person-centered care. A further incorrect approach might be to proceed with the requested modality without documenting the rationale for its selection or the discussion of alternatives. This failure in record-keeping is a direct contravention of HCPC standards, which require accurate and contemporaneous records to be maintained. It also hinders professional accountability and the ability to review or audit care decisions. The professional decision-making process for similar situations should involve 1. Actively listening to and acknowledging the service user's preferences and concerns. 2. Conducting a comprehensive assessment to understand the underlying needs and goals. 3. Evaluating the evidence base for the requested modality and any proposed alternatives in the context of the service user's specific condition and circumstances. 4. Engaging in a transparent discussion with the service user, outlining the pros and cons of different options, and collaboratively developing a treatment plan. 5. Documenting the entire process, including the rationale for the chosen approach and the informed consent obtained. Question 2. The assessment process reveals that a registered healthcare professional, while managing an acutely unwell patient, made a deviation from established protocol due to the patient's rapidly deteriorating condition. The immediate priority was to stabilize the patient, which was successfully achieved. However, the professional is now considering how to proceed with documenting this event. Which of the following represents the most appropriate course of action according to Health and Care Professions Council guidelines? Option A. Immediately stabilize the patient and then complete a comprehensive factual incident report detailing the deviation, the rationale, and the patient's response. Option B. Omit the incident from all records and reports as the patient's condition was stabilized and no immediate harm resulted. Option C. Submit a brief, anonymized report to the organization's incident system, omitting specific details about the deviation to avoid potential repercussions. Option D. Prioritize writing a detailed incident report before ensuring the patient is fully stabilized, as regulatory compliance is paramount. Correct answer is A. Immediately stabilize the patient and then complete a comprehensive, factual incident report detailing the deviation, the rationale, and the patient's response. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between immediate patient care needs and the mandatory requirement for thorough incident reporting. The practitioner is faced with a situation where a deviation from standard practice has occurred, potentially impacting patient safety. The urgency of the patient's condition necessitates immediate attention, but overlooking or inadequately documenting the incident could lead to a failure in professional accountability and a breach of regulatory obligations. The challenge lies in balancing the immediate clinical imperative with the long-term importance of learning from incidents to improve future care. Correct approach analysis. The correct approach prioritizes both immediate patient care and subsequent, thorough incident reporting. This aligns with the Health and Care Professions Council, HCPC, Standards of Proficiency and Conduct, which mandate that registrants must act in the best interests of patients, maintain accurate records, and report incidents. Stabilizing the patient is the immediate ethical and professional duty. Following this, a comprehensive and factual report detailing the deviation, the reasons for it, the patient's response, and any mitigating actions taken is crucial. This demonstrates accountability, facilitates learning for the individual and the wider profession, and ensures transparency with the regulatory body. It upholds the principle of openness and honesty expected of all HCPC registrants. Incorrect approaches analysis. Failing to report the incident entirely is a direct breach of the HCPC guidance on reporting concerns and maintaining fitness to practice. It undermines patient safety by preventing learning from errors and potentially concealing a pattern of substandard practice. This approach demonstrates a lack of accountability and a disregard for professional standards. Reporting the incident but omitting critical details or being deliberately vague is also professionally unacceptable. The HCPC expects accurate and factual record keeping. Inaccurate or incomplete reporting can mislead investigations, hinder learning, and fail to adequately inform the regulatory body of potential risks. This approach can be seen as an attempt to minimize personal responsibility rather than engage in genuine reflection and improvement. Prioritizing the incident report over immediate necessary patient care would be a failure to uphold the primary duty of care. While reporting is vital, the immediate safety and well-being of the patient must always take precedence in an emergency situation. This approach demonstrates a misapplication of professional priorities. Professional reasoning. Professionals facing such situations should employ a structured decision-making process. Firstly, assess the immediate clinical situation and prioritize patient safety. Stabilize the patient and provide necessary care. Secondly, recognize the professional obligation to report deviations from standard practice. Thirdly, gather all relevant factual information about the incident, including the circumstances, the deviation, the patient's condition, and the actions taken. Fourthly, document this information accurately and objectively in the incident report, adhering to organizational policies and HCPC guidelines. Finally, reflect on the incident to identify learning points and implement strategies to prevent recurrence. This systematic approach ensures both immediate patient welfare and long-term professional accountability and development. Question 3. The performance metrics show a slight but consistent decrease in patient satisfaction scores related to communication and perceived understanding over the last quarter. As a healthcare professional, how should you best respond to this feedback while upholding the principles of active listening and empathy in patient interactions? Option A. Focus solely on improving the technical aspects of patient care, assuming that excellent clinical outcomes will naturally address any perceived communication issues. Option B. Review the specific patient feedback and consider observing interactions to identify potential areas where active listening or empathetic responses could be enhanced, while also reflecting on personal practice. Option C. Immediately dismiss the metrics as likely being due to external factors or misinterpretation by patients, as your personal experience of providing empathetic care remains strong. Option D. Implement a series of superficial communication techniques without deeply exploring the underlying reasons for the feedback or engaging in self-reflection. The correct answer is B. Review the specific patient feedback and consider observing interactions to identify potential areas where active listening or empathetic responses could be enhanced, while also reflecting on personal practice. Explanation: this scenario is professionally challenging because it involves a direct conflict between observed performance data and the practitioner's subjective experience of patient interaction. The practitioner must reconcile potentially objective, albeit aggregated, metrics with the nuanced, qualitative nature of active listening and empathy. This requires careful judgment to avoid dismissing valid feedback or overreacting to potentially incomplete data. The correct approach represents best professional practice because it prioritizes a balanced and evidence-informed response. By acknowledging the performance metrics, the practitioner demonstrates a commitment to accountability and continuous improvement, aligning with the Health and Care Professions Council (HCPC) standards of proficiency, which require registrants to maintain and improve their knowledge and skills and to practice effectively. Simultaneously, by seeking to understand the context and nuances of patient interactions through direct observation and feedback, the practitioner upholds the HCPC emphasis on providing high-quality care and maintaining public trust. This approach reflects a commitment to reflective practice, a core tenet of professional development and ethical conduct, enabling the practitioner to identify areas for growth while also validating their own professional judgment. An incorrect approach that focuses solely on dismissing the metrics as inaccurate fails to acknowledge the potential for systemic issues or areas where practice could be enhanced. This could be seen as a failure to engage with feedback and a lack of commitment to professional development, potentially contravening the HCPC expectations for registrants to be open to feedback and to learn from experience. Another incorrect approach that immediately assumes a deficiency without seeking further understanding risks misinterpreting the data and could lead to unnecessary anxiety or a defensive posture, hindering genuine improvement. This overlooks the importance of a thorough and objective assessment before implementing changes. A third incorrect approach that focuses only on superficial changes without addressing the underlying skills of active listening and empathy would not lead to meaningful improvement and would fail to meet the spirit of the feedback, potentially impacting patient experience and safety, which are paramount under HCPC guidance. The professional decision-making process should involve a structured approach. First, acknowledging and reviewing the performance metrics objectively. Second, seeking to understand the context and specific examples that may have contributed to these metrics, perhaps through peer observation, patient surveys, or direct discussion with patients where appropriate and ethical. Third, engaging in self-reflection on personal active listening and empathy skills, potentially seeking mentorship or further training. Finally, developing and implementing a targeted action plan for improvement with a mechanism for re-evaluation. This iterative process ensures that professional development is data-informed, reflective, and patient-centered. Question 4. The performance metrics show a significant increase in patient wait times for initial assessments and a particular patient presents with symptoms that require immediate evaluation. The patient appears disoriented and is struggling to articulate their needs. What is the most appropriate initial step for the healthcare professional? Option A. Immediately commence a comprehensive physical and cognitive assessment to gather necessary data for diagnosis and treatment, given the urgency indicated by performance metrics and the patient's apparent distress. Option B. Attempt to communicate with the patient in a clear and simple manner, explaining the need for an assessment and seeking their agreement, while simultaneously assessing their capacity to consent. Option C. Document the patient's disorientation and delay the comprehensive assessment until a formal capacity assessment can be completed by a senior clinician. Option D. Proceed with a basic assessment of vital signs and a brief history from any accompanying individual, deferring a comprehensive assessment until the patient is more settled. The correct answer is A. Immediately commence a comprehensive physical and cognitive assessment to gather necessary data for diagnosis and treatment, given the urgency indicated by performance metrics and the patient's apparent distress. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a practitioner to balance the immediate need for information with the ethical and legal obligations to obtain informed consent and respect patient autonomy. The urgency of the situation, as indicated by the performance metrics, can create pressure to bypass standard procedures. However, the Health and Care Professions Council, HCPC, standards of proficiency and conduct emphasize the importance of patient-centered care, clear communication, and obtaining consent before undertaking any assessment or intervention. Failure to do so can lead to a breach of trust, potential harm, and regulatory action. Correct approach analysis. The correct approach involves prioritizing obtaining consent, even in a time-sensitive situation, by clearly and concisely explaining the purpose and nature of the assessment to the patient. This aligns with the HCPC requirement for registrants to communicate effectively and obtain consent before providing care. The practitioner must assess the patient's capacity to consent. If the patient has capacity, their decision must be respected. If the patient lacks capacity, the practitioner must act in the patient's best interests, which may involve seeking consent from a person lawfully able to give it on their behalf, or proceeding with essential life-saving treatment if no one is available and the situation is an emergency. This approach upholds patient autonomy and dignity, which are fundamental ethical principles and regulatory requirements. Incorrect approaches analysis. Proceeding with a comprehensive assessment without attempting to obtain consent, even if the patient appears distressed or unable to communicate effectively, is a failure to respect patient autonomy and a potential breach of the HCPC standards. This could be interpreted as treating the patient as an object of care rather than a person with rights. Similarly, assuming a patient cannot consent due to their current state without a proper assessment of their capacity is also a regulatory and ethical failure. The HCPC expects practitioners to make reasonable efforts to ascertain capacity and to involve the patient in decisions about their care as much as possible. Relying solely on the urgency indicated by performance metrics to justify bypassing consent procedures is a misapplication of professional judgment and disregards the fundamental right to consent. Professional reasoning. Professionals faced with such a situation should employ a structured decision-making process. First, they must assess the immediate clinical need and the potential for harm if assessment is delayed. Second, they must attempt to communicate with the patient, explaining the necessity of the assessment and seeking their agreement. Third, if the patient has capacity, their consent is paramount. Fourth, if the patient lacks capacity, the practitioner must follow established legal and ethical frameworks for acting in the patient's best interests, including seeking consent from a substitute decision-maker if available. Throughout this process, clear documentation of the assessment of capacity, the communication with the patient or their representative, and the rationale for the chosen course of action is essential. This systematic approach ensures that patient rights are protected while providing necessary care. Question 5. Consider a scenario where a registered healthcare professional observes a colleague repeatedly failing to adhere to established infection control protocols during patient care, such as inadequate hand hygiene and improper disposal of contaminated waste. The professional is concerned that this behavior poses a significant risk to patient safety and the wider healthcare environment. What is the most appropriate course of action for the observing professional? Option A. Ignore the observed breaches, assuming the colleague is aware of their actions and will correct them independently to avoid potential conflict or repercussions within the workplace. Option B. Discuss the observed breaches with other colleagues in informal settings to seek their opinions and gauge the extent of the problem before deciding on a course of action. Option C. Immediately report the colleague's behavior to senior management and the regulatory body without first attempting any direct communication or internal resolution, as the risk is perceived as immediate and severe. Option D. Document the observed breaches meticulously. Attempt a direct and constructive conversation with the colleague about the specific concerns, and if the behavior persists or the risk is deemed high, escalate the concerns through the appropriate internal reporting channels or to the relevant regulatory body as per professional guidance. The correct answer is D. Document the observed breaches meticulously. Attempt a direct and constructive conversation with the colleague about the specific concerns, and if the behavior persists or the risk is deemed high, escalate the concerns through the appropriate internal reporting channels or to the relevant regulatory body as per professional guidance. Explanation. This scenario presents a professional challenge due to the inherent conflict between a healthcare professional's duty of care to a patient and the potential for a colleague's practice to fall below acceptable standards, impacting patient safety. The Health and Care Professions Council, HCPC, Standards of Conduct, Performance and Ethics place a significant emphasis on accountability and responsibility for one's own practice and the practice of others. Professionals are expected to act with integrity, maintain high standards, and crucially, to raise concerns when patient safety or public confidence may be compromised. The correct approach demonstrates best professional practice by prioritizing patient safety and upholding the integrity of the profession. It involves a structured, proportionate, and documented process for addressing concerns. This aligns with HCPC guidance on raising concerns, which encourages professionals to address issues directly with the individual concerned, where appropriate and safe to do so, before escalating to a more formal route if the concerns persist or are serious. This approach ensures that potential harm is mitigated and that the professional acts ethically and in accordance with their regulatory obligations. Incorrect approaches fail to adequately address the potential risk to patients and undermine professional accountability. One incorrect approach might involve ignoring the situation due to personal discomfort or fear of repercussions. This is a failure of professional duty, as it allows potentially unsafe practice to continue unchecked, directly contravening the HCPC expectation that registrants will act to protect service users. Another incorrect approach could be to immediately report the colleague to external bodies without attempting any form of direct, constructive conversation or internal resolution, if appropriate. Reporting is sometimes necessary. Bypassing initial steps can be seen as unprofessional if the situation did not warrant such immediate escalation, potentially damaging professional relationships and not allowing for a potentially simpler resolution. A further incorrect approach might be to discuss the concerns with other colleagues in an informal, gossiping manner. This breaches confidentiality, can damage professional reputations unfairly, and does not constitute a formal or effective way to address a practice concern, failing to meet the standards of professional conduct and potentially creating a negative working environment. Professionals facing similar situations should employ a decision-making process that begins with assessing the severity and nature of the concern. They should consider the potential impact on patient safety and public trust. The next step involves consulting relevant professional guidelines and policies, such as those provided by the HCPC and their employer. If appropriate and safe, a direct, respectful conversation with the colleague about the observed practice should be considered. If the concern is serious, or if direct conversation is not feasible or effective, the professional should follow their employer's whistleblowing or concerns-raising policy, ensuring all actions are documented. This systematic approach ensures that concerns are addressed responsibly, ethically, and in a manner that protects both patients and the professional's own standing. Question 6. The investigation demonstrates that a clinical service is experiencing challenges in meeting its stated objectives. Which of the following approaches would constitute the most robust and professionally sound method for auditing and evaluating this service, in accordance with Health and Care Professions Council expectations? Option A. A comprehensive review of patient outcome data, patient feedback mechanism, and adherence to relevant professional guidelines and standards of practice. Option B. A series of informal discussions with senior clinical staff to gather their general impressions of the service's performance and any perceived difficulties. Option C. A comparative study of the service against a similar service in a different geographical region, without detailed consideration of the specific patient demographics or local regulatory nuances. Option D. An analysis focused primarily on reducing operational costs by identifying areas where staffing levels or resource allocation can be decreased. The correct answer is A. A comprehensive review of patient outcome data, patient feedback mechanisms, and adherence to relevant professional guidelines and standards of practice. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a healthcare professional to critically evaluate the effectiveness and efficiency of a clinical service. The challenge lies in moving beyond superficial observations to a rigorous assessment that can inform meaningful improvements, ensuring patient safety and optimal resource utilization, all within the regulatory framework of the Health and Care Professions Council, HCPC. The need for evidence-based evaluation and the potential impact on patient care necessitate careful judgment. Correct approach analysis. The correct approach involves a systematic review of clinical outcomes data, patient feedback, and adherence to established professional standards and guidelines. This aligns with the HCPC emphasis on maintaining high standards of practice, competence, and conduct. By examining objective data and subjective experiences, the evaluation provides a comprehensive picture of service performance. This approach is best professional practice as it is evidence-based, patient-centered, and directly addresses the HCPC requirement for registrants to practice safely and effectively. It allows for the identification of specific areas for improvement and the development of targeted interventions, thereby upholding public trust and ensuring the quality of care. Incorrect approaches analysis. One incorrect approach focuses solely on anecdotal evidence from staff without correlating it with objective data. This fails to meet the HCPC standards for evidence-based practice and can lead to biased conclusions, potentially overlooking systemic issues or overemphasizing individual perceptions. It lacks the rigor required for a robust audit and can result in ineffective or misdirected improvement strategies. Another incorrect approach prioritizes cost-saving measures above all else, without a thorough assessment of the impact on clinical quality or patient outcomes. While efficiency is important, the HCPC mandates that patient safety and well-being are paramount. Such an approach risks compromising care standards and could lead to regulatory breaches if it negatively affects patient care. A third incorrect approach involves comparing the service to competitors without understanding the specific context, patient population, or regulatory environment of the service being evaluated. Benchmarking is useful, but it must be done with a clear understanding of the relevant factors and the specific objectives of the audit. A superficial comparison can lead to irrelevant conclusions and inappropriate recommendations, failing to address the unique needs and challenges of the service under review. Professional reasoning. Professionals should approach the audit and evaluation of clinical services with a structured, evidence-based methodology. This involves defining clear objectives, selecting appropriate metrics, both quantitative and qualitative, collecting reliable data, analyzing findings objectively, and developing actionable recommendations. The process should always be guided by the HCPC standards of proficiency and standards of conduct, performance, and ethics, ensuring that patient safety, quality of care, and professional accountability are at the forefront of any evaluation. A critical self-reflection on the process and outcomes, and a commitment to continuous improvement are essential. Question 7. Upon reviewing updated clinical guidelines recommending the use of a new medication with a potentially significant impact on patient outcomes, but for which local protocols and staff training are not yet fully developed, what is the most appropriate course of action to ensure patient safety? Option A. Rely exclusively on the information provided by the pharmaceutical manufacturer for administration and monitoring, without developing specific local protocols or conducting independent staff training. Option B. Implement a phased rollout of the new medication, commencing with a small, closely monitored patient group, while simultaneously developing comprehensive local protocols and providing targeted staff training. Option C. Immediately begin administering the new medication to all eligible patients as per the updated guidelines, assuming that existing general medication administration training is sufficient. Option D. Delay the introduction of the new medication indefinitely until a complete, exhaustive body of evidence and universally agreed-upon protocols are available, even if this means patients miss out on potential benefits. Correct answer is B. Implement a phased rollout of the new medication, commencing with a small, closely monitored patient group, while simultaneously developing comprehensive local protocols and providing targeted staff training. Explanation. This scenario presents a professional challenge due to the inherent risk to patient safety when a new, potentially life-saving medication is introduced without a robust, established protocol for its administration and monitoring. The Health and Care Professions Council, HCPC, mandates that registrants must uphold standards of patient care, which includes ensuring that any treatment or intervention is delivered safely and effectively. The introduction of a novel medication necessitates a proactive approach to identify and mitigate potential risks. The correct approach represents best professional practice because it prioritizes patient safety by establishing clear guidelines and ensuring that all relevant professionals are adequately trained and informed before administering the medication. This aligns with the HCPC standards of proficiency, which require registrants to maintain and improve their knowledge and skills, and to practice within their scope of competence. Furthermore, it reflects the ethical duty of care to avoid causing harm and to act in the best interests of patients. Implementing a phased rollout with rigorous monitoring allows for early detection of adverse events and provides an opportunity to refine protocols based on real-world experience, thereby safeguarding patients. An incorrect approach that involves immediate widespread administration without prior training or protocol development would be a significant regulatory and ethical failure. This would breach the HCPC standards of conduct, performance, and ethics, specifically the requirement to provide a high standard of care and to work within the limits of their knowledge and skills. It demonstrates a disregard for patient safety by exposing them to potential harm without adequate safeguards. Another incorrect approach, such as relying solely on the pharmaceutical company's limited information without independent verification or local protocol development, also fails to meet professional standards. While collaboration with manufacturers is important, registrants have a primary responsibility to ensure patient safety within their specific practice setting. This approach outsources critical safety considerations, potentially overlooking unique patient populations or local resource limitations. A third incorrect approach, delaying administration indefinitely due to a lack of immediate comprehensive data, while seemingly cautious, can also be professionally problematic if it unnecessarily deprives patients of a potentially beneficial treatment. The professional decision-making process should involve a balanced assessment of risks and benefits, a commitment to evidence-based practice, and a proactive strategy for risk mitigation. Professionals should engage in critical evaluation of new information, collaborate with colleagues and relevant bodies, and implement appropriate safeguards to ensure patient well-being. This involves a continuous cycle of learning, adaptation, and adherence to regulatory and ethical obligations. Question 8. Stakeholder feedback indicates a perceived inconsistency in how practitioners apply evidence-based practice and clinical guidelines when patient preferences or anecdotal experiences seem to contradict established recommendations. A physiotherapist is reviewing their approach to managing a common musculoskeletal condition for which a clear, evidence-based guideline exists. The physiotherapist has observed a particular technique that, in their experience, seems to yield faster symptomatic relief for some patients, even though it is not explicitly detailed or recommended in the current guideline. How should the physiotherapist proceed to ensure their practice aligns with professional standards and best evidence? Option A. Prioritize the physiotherapist's observed technique, as personal experience and anecdotal evidence are often more relevant to individual patient needs than generalized guidelines. Option B. Disregard the evidence-based guideline entirely, as it does not reflect the physiotherapist's practical observations and may be outdated. Option C. Systematically review the existing evidence-based guideline, critically appraise the evidence supporting the guideline, and then explore the patient's preferences and individual circumstances to determine the most appropriate course of action, potentially including a discussion about the observed technique if it can be safely integrated or if the guideline has limitations for this specific patient. Option D. Implement the observed technique immediately for all patients presenting with this condition, assuming that personal experience represents a superior form of evidence. The correct answer is C. Systematically review the existing evidence-based guideline, critically appraise the evidence supporting the guideline, and then explore the patient's preferences and individual circumstances to determine the most appropriate course of action, potentially including a discussion about the observed technique if it can be safely integrated or if the guideline has limitations for this specific patient. Explanation. This scenario presents a professional challenge because it requires a healthcare professional to balance the immediate needs of a patient with the imperative to adhere to established evidence-based practice and clinical guidelines, as mandated by the Health and Care Professions Council, HCPC. The tension arises when a patient's expressed preference or a clinician's anecdotal experience appears to diverge from the current best available evidence. Navigating this requires critical appraisal skills, ethical reasoning, and effective communication. The correct approach represents best professional practice because it prioritizes patient safety and quality of care by grounding clinical decisions in robust evidence. Adhering to HCPC standards means professionals must maintain their knowledge and skills, which includes understanding and applying relevant clinical guidelines. When a guideline exists, it signifies a consensus of expert opinion and research findings on the most effective and safe way to manage a particular condition. The correct approach involves a systematic process of reviewing the evidence, considering the individual patient's context, and engaging in shared decision-making. This upholds the professional's duty of care and their responsibility to practice in accordance with recognized standards. An incorrect approach that disregards established evidence-based guidelines, even if based on personal experience or a single case, represents a failure to meet the HCPC standards for professional conduct and competence. This could lead to suboptimal patient outcomes, potential harm, and a breach of the professional's ethical obligations. Relying solely on anecdotal evidence or personal preference without critically evaluating it against current best practice is a significant regulatory and ethical failure. It demonstrates a lack of commitment to continuous professional development and a failure to uphold the principles of evidence-based practice, which are fundamental to safe and effective healthcare. The professional decision-making process for similar situations should involve 1. Identifying the core clinical issue and the patient's needs and preferences. 2. Consulting relevant, up-to-date, evidence-based clinical guidelines and research. 3. Critically appraising the evidence and the applicability of the guidelines to the specific patient. 4. Discussing the evidence, potential treatment options, and their implications with the patient, facilitating shared decision-making. 5. Documenting the decision-making process, including the rationale for any deviation from standard guidelines, if clinically justified and agreed upon with the patient. 6. Seeking peer consultation or expert opinion if uncertainty exists. Question 9. Examination of the data shows that a competent adult patient who has been fully informed about the risks, benefits, and alternatives of a proposed medical intervention has clearly and consistently refused this intervention. The patient articulates a clear understanding of the consequences of their refusal. The healthcare professional believes the intervention is in the patient's best interests and that refusal could lead to significant deterioration. What is the most appropriate course of action for the healthcare professional? Option A. Proceed with the intervention, overriding the patient's refusal, as the professional's judgment of the patient's best interests takes precedence. Option B. Respect the patient's decision and document their refusal, continuing to offer support and alternative care options that the patient is willing to accept. Option C. Attempt to persuade the patient to change their mind through repeated arguments and appeals to their family, without further formal capacity assessment. Option D. Discontinue all professional engagement with the patient due to the disagreement, as further intervention would be futile. The correct answer is B. Respect the patient's decision and document their refusal, continuing to offer support and alternative care options that the patient is willing to accept. Explanation. Scenario analysis. This scenario presents a professional challenge where a healthcare professional must balance a patient's expressed wishes with their perceived best interests, particularly when the patient's capacity to make decisions is in question. The core tension lies between upholding patient autonomy, a fundamental ethical principle, and the professional duty of care, which includes safeguarding the patient from harm. The professional must navigate this delicate balance without resorting to paternalism or coercion, ensuring that any decision respects the patient's dignity and rights. Correct approach analysis. The correct approach involves a thorough and documented assessment of the patient's capacity to consent to the proposed treatment. This assessment should be conducted by a suitably qualified professional and should consider whether the patient can understand the information relevant to the decision, retain that information, use or weigh that information as part of a decision-making process, and communicate their decision. If capacity is confirmed, the professional must respect the patient's decision, even if it differs from the professional's recommendation, provided it is lawful. This aligns with the Health and Care Professions Council, HCPC, standards of conduct, performance, and ethics, which emphasize respecting patients' rights to make informed decisions about their care and treatment. The professional's role is to provide clear, understandable information, and support the patient in their decision-making, not to impose their own views. Incorrect approach is analysis. One incorrect approach would be to proceed with the treatment against the patient's explicit refusal, assuming the professional knows best. This is a failure to respect patient autonomy and can be considered a breach of the HCPC standards regarding informed consent and patient rights. It undermines the patient's right to self-determination and can lead to a breakdown of trust. Another incorrect approach would be to abandon the patient or cease all engagement because of the disagreement. This would be a failure of the professional duty of care. The professional still has a responsibility to ensure the patient receives appropriate care, which may involve seeking alternative solutions, involving other professionals, or facilitating a second opinion, all while continuing to engage with the patient respectfully. A third incorrect approach would be to coerce or unduly influence the patient into accepting the treatment. This violates the principle of informed consent, which requires decisions to be voluntary and free from pressure. The HCPC standards clearly state that professionals must not exploit their position or patient's vulnerability. Professional reasoning. When faced with such a dilemma, a professional should follow a structured decision-making process. First, they must gather all relevant information about the patient's condition and the proposed treatment. Second, they must assess the patient's capacity to make the decision, documenting this assessment thoroughly. If the patient has capacity, their decision must be respected. If capacity is lacking, the professional must act in the patient's best interests, involving those close to the patient where appropriate and following relevant legal frameworks for decision-making for incapacitated individuals. Throughout this process, clear, open, and honest communication with the patient and their family or carers is paramount. Seeking advice from colleagues or supervisors is also a crucial step when uncertainty exists. Question 10. Performance analysis shows a recent incident where a patient experienced a significant adverse event due to a breakdown in communication between two healthcare professionals. While immediate steps have been taken to ensure the patient's current well-being, what is the most appropriate next step for the involved professional to ensure robust risk management and prevent future occurrences, in line with health and care professions' council expectations? Option A. Document the incident in the patient's record and consider it an isolated event that is unlikely to happen again. Option B. Focus on reinforcing immediate communication protocols with the specific colleague involved to prevent a repeat of the same error. Option C. Initiate a formal incident review process to identify root causes, contributing factors, and develop preventative strategies. Option D. Discuss the incident informally with their immediate supervisor to gauge their opinion on how to proceed. Correct answer is C. Initiate a formal incident review process to identify root causes, contributing factors, and develop preventative strategies. Explanation. This scenario presents a professional challenge due to the inherent tension between immediate patient care needs and the systematic, evidence-based approach required for effective risk management. Healthcare professionals are often faced with urgent situations that demand rapid decision-making, which can sometimes lead to overlooking or deprioritizing the underlying systemic issues that contribute to adverse events. The Health and Care Professions Council, HCPC Standards of Proficiency and Conduct, require registrants to maintain high standards of care, which includes proactively identifying and mitigating risks to patient safety. This necessitates a balanced approach that addresses immediate concerns while also contributing to long-term improvements. The correct approach represents best professional practice because it directly aligns with the HCPC emphasis on a proactive and reflective approach to risk management. By initiating a formal review process, the professional demonstrates a commitment to understanding the root causes of the incident, rather than just addressing the immediate consequences. This systematic investigation, which would likely involve gathering data, analyzing contributing factors, and developing preventative strategies, is crucial for preventing recurrence and improving overall service quality. This aligns with the HCPC requirement for registrants to practice effectively and to contribute to the development of services. An incorrect approach that focuses solely on immediate remedial actions without a broader review fails to address the systemic issues that may have led to the incident. This could be seen as a failure to uphold the HCPC standards of proficiency related to professional development and the improvement of practice. It risks a band-aid solution that does not prevent future occurrences. Another incorrect approach, such as dismissing the incident as an isolated event without further investigation, directly contravenes the principles of learning from experience and continuous improvement, which are fundamental to professional accountability under the HCPC framework. This approach neglects the duty to protect the public by failing to identify and address potential vulnerabilities in the system. A third incorrect approach, which involves solely relying on the immediate supervisor's informal assessment, bypasses the structured and documented processes expected for significant incidents, potentially leading to inconsistent risk assessment and a lack of accountability, which is contrary to the HCPC expectation for robust governance and quality assurance. Professional decision-making in such situations requires a framework that prioritizes patient safety, adheres to regulatory standards, and promotes a culture of learning. This involves 1. Immediate action to ensure patient safety, 2. Reporting and documenting the incident according to organizational policy, 3. Initiating a formal review process to identify root causes, 4. Implementing evidence-based recommendations for improvement, and 5. Reflecting on the experience for personal and professional development. This systematic approach ensures that both immediate needs and long-term safety are addressed, in line with the HCPC overarching mandate to protect the public. Question 11. Quality control measures reveal a practitioner is consistently selecting interventions for patients with chronic pain based on their personal familiarity with the techniques rather than a systematic review of current research. Which of the following approaches best aligns with the health and care professions counsel's expectations for evidence-based practice? Option A. Continuing to use familiar techniques, assuming they have been effective for similar patients in the past, to ensure consistency of care. Option B. Relying on anecdotal reports from colleagues about the success of certain interventions without independent verification of the evidence. Option C. Prioritizing interventions supported by robust, peer-reviewed research demonstrating efficacy and safety for the specific condition and patient profile. Option D. Adopting the latest trending intervention promoted within professional networks, irrespective of a comprehensive evidence review. The correct answer is C. Prioritizing interventions supported by robust, peer-reviewed research demonstrating efficacy and safety for the specific condition and patient profile. Explanation. Scenario analysis. This scenario presents a professional challenge where a practitioner must select the most appropriate evidence-based intervention for a patient with a specific condition, balancing clinical judgment with the imperative to adhere to established best practices. The challenge lies in discerning which intervention is supported by the strongest, most relevant evidence, considering the patient's unique presentation and the potential for differing interpretations of research findings. The Health and Care Professions Council, HCPC, standards of proficiency and conduct require practitioners to maintain and update their knowledge and skills, and to provide safe and effective care based on the best available evidence. Correct approach analysis. The correct approach involves critically evaluating the available research to identify interventions with robust evidence of efficacy and safety for the specific condition and patient demographic. This aligns with the HCPC expectation that practitioners base their practice on current evidence and best practice guidelines. It demonstrates a commitment to professional accountability and patient well-being by prioritizing interventions that have been rigorously tested and validated, thereby minimizing the risk of ineffective or harmful treatment. Incorrect approaches analysis. An approach that relies solely on anecdotal experience or personal preference, without reference to current evidence, fails to meet the HCPC standards for evidence-based practice. This can lead to the use of outdated or unproven interventions, potentially compromising patient safety and outcomes. It also neglects the professional obligation to stay abreast of developments in the field. An approach that prioritizes interventions that are readily available or familiar, even if they lack strong supporting evidence, also falls short. While practical considerations are important, they should not supersede the primary duty to provide care that is demonstrably effective and safe. This approach risks perpetuating suboptimal care and failing to offer patients the most beneficial treatment options. An approach that adopts a new intervention without a thorough review of its evidence base, simply because it is novel or promoted by a colleague, is also professionally unsound. The HCPC expects practitioners to exercise critical judgment and to ensure that any new approach is supported by credible research and has been evaluated for its effectiveness and safety in relevant populations. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough assessment of the patient's condition and needs. This should be followed by a comprehensive review of the current evidence base, including systematic reviews, meta-analyses, and high-quality clinical trials, to identify evidence-based interventions. Clinical guidelines and expert consensus should also be consulted. The practitioner must then critically appraise the evidence, considering its relevance to the individual patient, and integrate this with their own clinical expertise and the patient's preferences and values. This iterative process ensures that the chosen intervention is both evidence-informed and tailored to the individual. Question 12. Analysis of a situation where a registered healthcare professional observes a discrepancy between a patient's current clinical presentation and the documented treatment plan provided by another member of the multidisciplinary team. The professional is concerned that this discrepancy may put the patient at risk of suboptimal care or harm. What is the most appropriate course of action to ensure patient safety and uphold professional standards? Option A. Make a note of the discrepancy in the patient's record for future reference, but take no immediate action to address it. Option B. Directly and professionally communicate the observed discrepancy to the clinician responsible for the treatment plan, seeking clarification and discussing potential implications for the patient's care. Option C. Assume the documented plan is correct and that the patient's presentation is a natural progression, without seeking further information. Option D. Discuss the observed discrepancy with other colleagues, not directly involved in the patient's care, to gather their opinions before taking any action. The correct answer is B. Directly and professionally communicate the observed discrepancy to the clinician responsible for the treatment plan, seeking clarification and discussing potential implications for the patient's care. Explanation. This scenario presents a professional challenge due to the inherent complexities of interprofessional communication and collaboration within the healthcare setting, particularly when patient safety is potentially compromised. The need for timely and accurate information sharing between different healthcare professionals is paramount, and any breakdown in this process can have serious consequences. The Health and Care Professions Council, HCPC, Standards of Proficiency and Conduct emphasize the importance of effective communication and working collaboratively with colleagues to ensure the best interests of patients are met. The correct approach involves a direct, professional, and documented communication with the responsible clinician, clearly outlining the concerns and seeking clarification or intervention. This aligns with HCPC guidance on professional conduct, which mandates that registrants must communicate effectively, share information appropriately, and act in the best interests of patients. By directly addressing the issue with the relevant professional, the individual is upholding their duty of care, promoting patient safety, and adhering to collaborative working principles. This approach fosters a culture of open communication and accountability, essential for high-quality patient care. An incorrect approach would be to ignore the discrepancy or to discuss it with colleagues not directly involved in the patient's care, without first attempting to resolve it with the responsible clinician. Ignoring the issue constitutes a failure to act in the patient's best interest and a potential breach of the duty of care. Discussing the issue with uninvolved colleagues could be seen as gossip or a breach of patient confidentiality, depending on the context, and does not address the immediate need for clarification or correction. Another incorrect approach would be to make assumptions about the discrepancy without seeking clarification, which could lead to further errors or misjudgments. These approaches fail to demonstrate professional responsibility, effective communication, and a commitment to patient safety as required by the HCPC. Professionals should employ a decision-making process that prioritizes patient well-being. This involves 1. Identifying the concern and its potential impact on the patient. 2. Consulting relevant professional standards and ethical guidelines, e.g., HCPC standards. 3. Determining the most direct and appropriate professional to address the concern. 4. Communicating the concern clearly, respectfully, and factually, seeking resolution. 5. Documenting the communication and any subsequent actions. If the initial communication does not resolve the issue, escalating the concern through appropriate channels becomes necessary. Question 13. The efficiency study reveals that a significant number of practitioners are completing patient consultations within a reduced time frame, leading to concerns about the depth of clinical history taking and physical examination. In this context, what is the most appropriate professional response to ensure patient safety and diagnostic accuracy, adhering to Health and Care Professions Council standards? Option A. Focus on a brief history and examination of the most obvious signs, assuming that more complex issues will be identified through subsequent investigations. Option B. Adopt a streamlined approach to history taking and examination, focusing only on the most common symptoms associated with the presenting complaint to maximize efficiency. Option C. Rely on patient self-reporting of symptoms and delegate parts of the physical examination to support staff to expedite the consultation process. Option D. Prioritize a comprehensive clinical history and physical examination, even if it extends beyond the average consultation time, to ensure all relevant information is gathered and a thorough assessment is made. Correct answer is D. Prioritize a comprehensive clinical history and physical examination, even if it extends beyond the average consultation time, to ensure all relevant information is gathered and a thorough assessment is made. Explanation. This scenario is professionally challenging because it requires the practitioner to balance the need for thorough clinical assessment with the pressures of time and resource constraints, which can impact patient care and professional judgment. Health and Care Professions Council, HCPC, Standards of Proficiency and Conduct emphasize the importance of providing safe and effective care, which includes accurate history-taking and physical examination. The correct approach represents best professional practice because it prioritizes patient safety and diagnostic accuracy by ensuring all relevant information is gathered and a comprehensive examination is performed, even if it requires additional time. This aligns with the HCPC requirement for practitioners to maintain high standards of professional conduct and to act in the best interests of patients. It demonstrates a commitment to evidence-based practice and a thorough understanding of the patient's condition, which is fundamental to effective treatment planning and management. An incorrect approach that focuses solely on speed without adequate information gathering would fail to meet the HCPC standards for safe practice. It could lead to misdiagnosis, delayed treatment, or inappropriate interventions, thereby compromising patient well-being and potentially breaching professional conduct requirements. Another incorrect approach that relies on assumptions or incomplete data collection without seeking clarification or further investigation would also be professionally unacceptable. This demonstrates a lack of due diligence and a failure to uphold the duty of care owed to the patient, which is a core ethical and regulatory obligation. Professionals should employ a decision-making framework that involves a systematic assessment of the patient's presenting complaint, consideration of differential diagnoses, and a plan for history-taking and physical examination that is tailored to the individual. This framework should include a continuous evaluation of the information gathered, a willingness to adapt the examination based on findings, and a commitment to seeking further information or consultation when necessary, all within the bounds of professional competence and ethical responsibility, as outlined by the HCPC. Question 14. Compliance review shows a registered healthcare professional has a deeply held personal belief that conflicts with a specific, clinically indicated treatment requested by a patient. The professional is concerned about their ability to provide this treatment without compromising their personal ethical framework. What is the most appropriate course of action for the professional to take? Option A. Discuss the conflict openly with the patient. Explore alternative arrangements for the patient to receive the treatment from another practitioner and ensure continuity of care. Option B. Proceed with providing the treatment while experiencing significant moral distress, hoping to manage it without impacting the patient's care. Option C. Refuse to provide the treatment to the patient, citing personal beliefs, without exploring any alternative care options or informing the patient of the conflict. Option D. Advise the patient that their request cannot be fulfilled due to the professional's personal beliefs, and suggest the patient seek care elsewhere without further assistance. The correct answer is A. Discuss the conflict openly with the patient. Explore alternative arrangements for the patient to receive the treatment from another practitioner and ensure continuity of care. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves a conflict between a healthcare professional's personal beliefs and their duty of care to a patient. The professional is faced with a situation where their deeply held ethical or religious convictions might prevent them from providing a treatment that is clinically indicated and desired by the patient. This requires careful navigation to uphold both professional responsibilities and personal integrity, without compromising patient well-being or trust. The challenge lies in balancing the right to conscientious objection with the fundamental duty to provide care. Correct approach analysis. The correct approach prioritizes the patient's autonomy and right to receive appropriate care. It involves transparent communication with the patient about any potential conflicts, exploring alternative arrangements for care provision, and ensuring continuity of treatment. This aligns with the Health and Care Professions Council, HCPC, standards of conduct, performance, and ethics, which emphasize acting in the best interests of patients, maintaining public trust, and working within the scope of practice. Specifically, it upholds the principles of patient-centered care and non-maleficence by ensuring the patient is not disadvantaged by the professional's personal beliefs. The professional's duty is to facilitate the patient's access to care, even if they cannot personally provide it. Incorrect approaches analysis. One incorrect approach involves refusing to provide the treatment without exploring alternatives or informing the patient of the conflict. This fails to uphold the duty of care and can be seen as abandoning the patient, leading to potential harm and a breach of professional ethics. It also erodes public trust in the profession. Another incorrect approach is to provide the treatment while experiencing significant moral distress, potentially impacting the quality of care or leading to resentment. This is not in the patient's best interest and can compromise the professional's own well-being and professional integrity. A third incorrect approach is to dismiss the patient's request or needs due to personal discomfort, without engaging in a professional dialogue or seeking appropriate solutions. This demonstrates a lack of respect for patient autonomy and a failure to adhere to professional standards of communication and care. Professional reasoning. Professionals facing such dilemmas should follow a structured decision-making process. First, they must identify the ethical conflict. Second, they should consult relevant professional codes of conduct and ethical guidelines, such as those provided by the HCPC. Third, they should engage in open and honest communication with the patient, explaining their position and exploring the patient's wishes and needs. Fourth, they should consider all available options, including seeking advice from colleagues, supervisors, or professional bodies, and exploring alternative care arrangements to ensure the patient's needs are met without compromising their own ethical boundaries. The ultimate goal is to resolve the conflict in a way that prioritizes patient safety, well-being, and autonomy. Question 15. Research into the legal and ethical frameworks governing health and care professionals in the UK. What is the primary consideration for a registrant when a patient discloses information that may indicate a risk of harm to themselves or others? Option A. Disregarding the disclosure if it does not directly relate to the registrant's specific area of practice. Option B. Determining if the disclosed information triggers a specific statutory duty to report to the relevant authorities. Option C. Seeking immediate advice from colleagues without assessing the urgency or nature of the disclosure. Option D. Maintaining absolute patient confidentiality to preserve the therapeutic relationship, regardless of the nature of the disclosure. The correct answer is B. Determining if the disclosed information triggers a specific statutory duty to report to the relevant authorities. Explanation. Scenario analysis. This scenario presents a professional challenge for a registrant of the Health and Care Professions Council, HCPC, due to the inherent tension between patient confidentiality and the legal obligation to report certain information. The registrant must navigate the complex interplay of the HCPC standards of conduct, performance, and ethics, data protection legislation, such as the Data Protection Act 2018 and UK GDPR, and specific reporting duties mandated by other statutes. Failure to correctly identify and act upon a reporting obligation can lead to serious consequences for the patient, the registrant, and the public. The challenge lies in accurately interpreting the scope of the registrant's duties and the specific circumstances that trigger a mandatory report, while also upholding patient trust. Correct approach analysis. The correct approach involves a thorough understanding of the registrant's professional obligations as outlined by the HCPC and relevant UK legislation. This includes recognizing that while patient confidentiality is paramount, it is not absolute. The registrant must be aware of specific legal duties to report, such as those related to safeguarding children or vulnerable adults, or reporting certain infectious diseases. In this scenario, the registrant's duty is to assess whether the information shared by the patient falls within a legally mandated reporting requirement. If it does, the registrant must follow the correct procedure for reporting, which typically involves informing the appropriate authorities, e.g., social services, police, Public Health England, while also considering how to communicate this to the patient in a sensitive and transparent manner, where appropriate and safe to do so. This approach upholds both professional ethics and legal compliance, ensuring public safety and maintaining the integrity of the profession. Incorrect approach is analysis. Failing to report when legally required constitutes a breach of professional standards and potentially a criminal offense. This could stem from a misunderstanding of reporting duties or an overemphasis on confidentiality without recognizing its legal limitations. Such an approach risks harm to individuals who could have been protected by timely intervention and erodes public trust in the profession. Conversely, reporting information that is not legally mandated without proper justification or consideration of proportionality violate patient confidentiality and data protection principles. This could damage the therapeutic relationship, deter patients from seeking help, and lead to disciplinary action. The registrant must exercise professional judgment to distinguish between situations requiring reporting and those where confidentiality should be maintained. Another incorrect approach would be to ignore the information entirely, assuming it is not the registrant's concern. This abdicates professional responsibility and fails to consider the potential impact on the patient or others. Registrants have a duty of care that extends to recognizing and acting upon situations that may pose a risk. Professional reasoning. Professionals facing such dilemmas should employ a structured decision-making process. Firstly, they must identify the core ethical and legal principles at play, such as confidentiality, duty of care, and statutory reporting obligations. Secondly, they should consult relevant professional guidance from the HCPC and applicable legislation. If uncertainty remains, seeking advice from supervisors, legal counsel, or professional bodies is crucial. The decision should be based on a careful assessment of the specific facts, the potential risks and benefits of each course of action, and the overarching aim of protecting individuals and upholding public trust. Documentation of the decision-making process is also essential. Question 16. Market research demonstrates that a pharmaceutical company is offering healthcare professionals a significant financial incentive for prescribing their new medication. A registrant, who has been considering this medication for a particular patient based on clinical need, receives a direct offer of a substantial personal bonus for every prescription of this drug they issue. The registrant is aware that the patient's clinical condition could also be managed effectively by a different, equally clinically appropriate medication from a competitor. Option A. Declare the offer to their employer and seek guidance on how to proceed, ensuring patient care remains paramount and free from undue influence. Option B. Accept the financial incentive and prescribe the alternative medication from the competitor, as this would avoid any appearance of impropriety related to the offer. Option C. Accept the financial incentive and prescribe the medication, confident in their ability to maintain objective clinical judgment for the patient. Option D. Decline the offer but continue to prescribe the medication if they believe it is clinically appropriate, without informing their employer. The correct answer is A. Declare the offer to their employer and seek guidance on how to proceed, ensuring patient care remains paramount and free from undue influence. Explanation. This scenario presents a professional challenge due to the inherent conflict between a registrant's duty to their patient and the potential for personal gain or benefit from a third party. The Health and Care Professions Council, HCPC, Standards of Conduct, Performance and Ethics require registrants to act in the best interests of their patients at all times, to maintain public trust and confidence in their profession, and to avoid conflicts of interest. The decision-making process must prioritize patient well-being and professional integrity over any external pressures or inducements. The correct approach involves transparently declaring the offer to the employer and seeking guidance, thereby upholding the registrant's duty of care and professional integrity. This aligns with HCPC guidance on conflicts of interest, which emphasizes the importance of disclosure and seeking advice to ensure that patient care is not compromised. By involving the employer, the registrant ensures that any decision made is in line with organizational policy and ethical best practice, safeguarding both the patient and the registrant. An incorrect approach that involves accepting the offer without disclosure would be a direct breach of the HCPC standards. This failure to declare a potential conflict of interest compromises patient autonomy and trust, as the registrant's professional judgment could be unduly influenced by the incentive. It also undermines the integrity of the profession by creating an appearance of impropriety. Another incorrect approach, accepting the offer and intending to continue providing unbiased care, is still problematic as it fails to acknowledge the potential asterisk for bias and the importance of transparency. The mere appearance of a conflict can erode public trust, even if the registrant believes their judgment remains unaffected. The professional reasoning framework to be employed in such situations involves a systematic approach. Identify the ethical issue, gather relevant information, including professional codes and employer policies. Consider the options, consult with appropriate individuals, employer, professional body, make a decision, and reflect on the outcome. This structured process ensures that decisions are ethically sound, legally compliant, and in the best interest of patients. Question 17. The monitoring system demonstrates that a healthcare professional has been using a personal messaging application to communicate with patients about their treatment plans and to share sensitive health information. This application is not an approved secure platform for patient communication. Which of the following actions best upholds the professional and ethical standards expected by the Health and Care Professions Council? Option A. Continue using the personal messaging application for convenience, but implement a policy of encrypting all messages sent to patients to mitigate potential data breaches. Option B. Immediately cease using the personal messaging application for patient communication and transition to an approved secure platform, ensuring all patient records are updated to reflect the change in communication method and any information previously shared. Option C. Document the use of the personal messaging application in the patient's electronic health record and continue its use, assuming that patient consent implicitly covers this method of communication. Option D. Inform patients that the personal messaging application is being used for convenience and advise them to be cautious about the information they share while continuing its use. The correct answer is B. Immediately cease using the personal messaging application for patient communication and transition to an approved secure platform, ensuring all patient records are updated to reflect the change in communication method and any information previously shared. Explanation. This scenario is professionally challenging because it requires balancing the benefits of technological advancements in healthcare communication with the fundamental ethical and regulatory obligations to protect patient confidentiality and ensure safe, effective care. The Health and Care Professions Council, HCPC, standards of proficiency and conduct are paramount, emphasizing the need for practitioners to maintain accurate records, communicate effectively, and use technology responsibly. The correct approach represents best professional practice because it prioritizes patient safety and data security while leveraging technology to enhance care delivery. It involves a proactive and informed engagement with technological tools, ensuring that their use aligns with HCPC guidelines on record keeping, confidentiality, and professional conduct. This approach demonstrates a commitment to continuous professional development and a responsible adoption of innovation that ultimately benefits patients. Incorrect approaches fail to uphold these core principles. One incorrect approach might involve the indiscriminate use of unverified communication platforms, which could lead to breaches of confidentiality and inaccurate record keeping, violating HCPC standards on data protection and professional accountability. Another incorrect approach could be the reliance on technology without adequate training or understanding of its limitations, potentially compromising the quality of care and patient safety. A third incorrect approach might be the failure to document communications adequately, undermining the integrity of patient records and hindering effective continuity of care, which is a direct contravention of record-keeping requirements. Professionals should employ a decision-making framework that involves assessing the suitability and security of any technology for its intended purpose, ensuring compliance with all relevant legislation, e.g., Data Protection Act 2018, GDPR, seeking appropriate training and understanding of the technology's functionalities and limitations, maintaining clear and accurate records of all communications and interventions, and always prioritizing patient well-being and confidentiality. When in doubt, seeking guidance from supervisors, professional bodies, or legal counsel is essential. Question 18. Which approach would be most appropriate when selecting and utilizing assessment tools and scales for a client presenting with complex and multifaceted needs? Option A. Rely primarily on the client's self-report of their symptoms to guide the choice of assessment tool, as their perspective is paramount. Option B. Prioritize using the most recently developed assessment tool, as newer tools are generally more advanced. Option C. Select a tool that is widely recognized and has a comprehensive manual, assuming it will be suitable for most clients. Option D. Critically evaluate the psychometric properties of potential tools, their appropriateness for the client's specific demographic and presenting issues, and ensure personal competence in their use. The correct answer is C. Select a tool that is widely recognized and has a comprehensive manual, assuming it will be suitable for most clients. Explanation. This scenario presents a professional challenge because the selection and application of assessment tools require a nuanced understanding of both the client's needs and the psychometric properties of the tools themselves. Professionals must ensure that the chosen tools are valid, reliable, and appropriate for the specific population and presenting issues, as mandated by the Health and Care Professions Council, HCPC, Standards of Proficiency, and the HCPC Guidance on Record Keeping and the Use of Professional Judgment. Failure to do so can lead to inaccurate assessments, misdiagnosis, inappropriate interventions, and ultimately, harm to the client. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based selection process. This involves critically evaluating the suitability of an assessment tool based on its psychometric properties, validity and reliability, its appropriateness for the client's demographic and presenting concerns, and the practitioner's competence in administering and interpreting it. This aligns with the HCPC emphasis on maintaining high standards of practice, ensuring competence, and acting in the best interests of service users. It demonstrates a commitment to evidence-based practice and ethical decision-making, ensuring that the assessment serves its intended purpose effectively and safely. An incorrect approach that involves using a widely recognized assessment tool without considering its specific suitability for the client's cultural background or presenting problem would be professionally unacceptable. This could lead to biased results or misinterpretation, failing to meet the HCPC standards for fair and equitable practice. Another incorrect approach, such as relying solely on the assessment tool's manual without considering the practitioner's own clinical judgment and understanding of the client, would also be a failure. The HCPC expects practitioners to exercise professional judgment and integrate information from various sources, not to blindly follow a tool. Using an assessment tool for which the practitioner has not received adequate training or supervision would be a direct contravention of the HCPC requirements for competence and safe practice, potentially leading to significant errors in assessment and intervention. Professionals should approach the selection and use of assessment tools by first clearly defining the assessment's purpose and the specific information required. They should then research available tools, critically evaluating their psychometric properties, cultural appropriateness, and relevance to the client's presenting issues. This evaluation should be followed by a consideration of their own competence and training in using the selected tool. Finally, the interpretation of results must be integrated with other clinical information and professional judgment, always in the best interests of the client and in accordance with HCPC standards. Question 19. The review process indicates that a referral for a patient to physiotherapy has been made by a consultant, but the physiotherapist who assessed the patient believes the referral is not clinically appropriate based on their recent assessment and the patient's stated goals. The physiotherapist has not been consulted regarding this new referral. What is the most appropriate course of action? Option A. Contact the patient directly to express concerns about the referral and ask them to clarify why they believe physiotherapy is needed, bypassing the referring consultant. Option B. Report the perceived inappropriate referral to a senior physiotherapy manager immediately, without first attempting to discuss it with the referring consultant. Option C. Proceed with the referral as received, assuming the consultant has made the most appropriate clinical decision, and address any concerns during the physiotherapy appointment. Option D. Initiate direct communication with the referring consultant to discuss the patient's assessment findings and the perceived appropriateness of the referral, seeking to collaboratively determine the best course of action for the patient. The correct answer is D. Initiate direct communication with the referring consultant to discuss the patient's assessment findings and the perceived appropriateness of the referral, seeking to collaboratively determine the best course of action for the patient. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a potential breakdown in communication and collaboration between different healthcare professionals, which could directly impact patient care and safety. The physiotherapist is faced with a situation where a referral decision has been made without their direct input, potentially overlooking crucial clinical information or the patient's specific needs as assessed by the physiotherapist. This highlights the importance of clear referral pathways and the ethical imperative to ensure all relevant professionals are involved in decisions affecting a patient's treatment plan. The HCPC standards of proficiency for physiotherapists emphasize the need for effective communication and collaboration with colleagues and other professionals. Correct approach analysis. The correct approach involves seeking clarification and engaging in direct communication with the referring clinician. This upholds the HCPC standards of proficiency, specifically those relating to communication and teamwork. By initiating a dialogue, the physiotherapist can ensure their professional judgment and patient assessment are considered, preventing potential harm or suboptimal care. This collaborative approach respects the roles and expertise of all involved professionals and prioritizes the patient's best interests, aligning with the ethical principles of beneficence and non-maleficence. It also demonstrates professional accountability by actively addressing a potential issue rather than passively accepting it. Incorrect approach is analysis. Failing to seek clarification and proceeding with the referral as is, without addressing the discrepancy, represents a failure to uphold professional standards of communication and collaboration. This could lead to a continuation of a flawed referral process, potentially resulting in inappropriate treatment or delayed care for the patient. It also neglects the physiotherapist's professional responsibility to advocate for their patient's needs based on their assessment. Directly contacting the patient to question the referral without first engaging with the referring clinician is a breach of professional boundaries and established referral pathways. It undermines the referring clinician's authority and could create confusion or distress for the patient. This approach bypasses the necessary interdisciplinary communication channels and demonstrates a lack of respect for colleagues. Escalating the issue to a senior manager without attempting to resolve it directly with the referring clinician first is premature. While escalation may be necessary in some circumstances, it should generally follow an attempt at direct resolution. This approach bypasses the opportunity for collaborative problem solving and can damage interdisciplinary working relationships. It also fails to demonstrate the professional's initiative in addressing the issue at the most appropriate level. Professional reasoning. Professionals should adopt a problem-solving approach that prioritizes patient safety and effective care. This involves 1. Identifying the issue, recognizing a discrepancy or potential problem in a referral process. 2. Seeking information, gathering all relevant facts and understanding the context. 3. Direct communication. Engaging with the relevant parties, in this case the referring clinician, to clarify and discuss concerns. 4. Collaborative decision-making, working together to find the best course of action for the patient. 5. Escalation if necessary. If direct communication fails to resolve the issue, then consider appropriate channels for escalation, ensuring patient welfare remains paramount. Question 20. The analysis reveals that a patient presents with a complex set of symptoms, and their family has provided a detailed account of their perceived issues. The patient themselves appears withdrawn and hesitant to elaborate on their experiences. In this situation, which approach to comprehensive patient assessment best upholds professional standards and promotes effective care? Option A. Prioritize the family's detailed account, as they have observed the patient's condition over time and can offer valuable insights into changes and patterns. Option B. Rely on the patient's initial brief statements, assuming their reluctance to speak further indicates a lack of significant issues requiring in-depth assessment. Option C. Focus exclusively on objective clinical signs and diagnostic test results, as these provide the most reliable and unbiased information about the patient's health status. Option D. Engage directly with the patient, actively listening to their concerns, asking open-ended questions to encourage elaboration, and seeking their consent to discuss their situation with their family to corroborate information. The correct answer is A. Prioritize the family's detailed account, as they have observed the patient's condition over time and can offer valuable insights into changes and patterns. Explanation. This scenario presents a professional challenge because the practitioner must integrate information from multiple sources, some of which may be incomplete or subjective, to form a holistic understanding of the patient's needs. The Health and Care Professions Council, HCPC, standards of proficiency require registrants to practice effectively, which includes undertaking comprehensive assessments. This necessitates not only gathering data, but also critically evaluating its relevance and reliability. The correct approach represents best professional practice because it prioritizes direct patient engagement and corroboration of information, aligning with the HCPC emphasis on patient-centered care and evidence-based practice. Actively listening to the patient, asking clarifying questions, and seeking consent for information sharing are fundamental ethical and professional obligations. This approach ensures that the assessment is accurate, respectful, and directly addresses the patient's stated concerns and observed needs, thereby promoting safe and effective care. An incorrect approach that relies solely on the family's interpretation without direct patient input fails to uphold the principle of patient autonomy and may lead to a biased or incomplete assessment. This could contravene HCPC standards related to respecting patient dignity and ensuring that care is based on a thorough understanding of their individual circumstances. Similarly, an approach that dismisses the patient's subjective experience in favor of purely objective findings neglects the psychosocial aspects of health, which are integral to a comprehensive assessment and can lead to misdiagnosis or inappropriate care plans. Relying on outdated or unverified information without seeking current patient input also risks providing care that is no longer relevant or effective, potentially compromising patient safety. Professionals should employ a structured decision-making process that begins with identifying the purpose of the assessment and the relevant professional standards. This involves systematically gathering information from all appropriate sources, including the patient, their family, with consent, and other healthcare professionals. Crucially, this information must be critically evaluated for accuracy, completeness, and relevance. The practitioner must then synthesize this data to form a professional judgment about the patient's condition and needs, always prioritizing the patient's perspective and well-being. Regular review and reassessment are also vital to ensure ongoing appropriateness of care.